member-only rewards, and surprises along the way. It's easy. It's convenient. It's the Zaxby's app. Download it today.
The weather is beautiful right now, no doubt, and chances are most of you are going to be spending as much time out in it as you possibly can. Hopefully you have learned the lesson to be sure and apply sunscreen before you do head out into the sun, regardless actually of the time of year. Dr. Deanna Brown is going to emphasize that point and also get you energized to come out for a very important walk and run. She joins us this morning. Good to see you.
Good to see you too, Julie.
You have been a very familiar face on the show. You, of course, are with Susong Dermatology, and most of us, I think, tend to think about wearing sunscreen just to kind of ward off some minor issues. But the truth is, the upcoming run, Elizabeth's Outrun Melanoma, brings awareness to a really, really important cause.
Absolutely. So the Elizabeth R. Smith 5K and run and walk is in its 9th year, and all of the proceeds benefit the CHI Memorial Elizabeth R. Smith Melanoma Program. So that's a program in our community that supports patients here who have been diagnosed with melanoma and who are going through treatment.
So is it the kind of thing, Dr. Brown, where I think here I am, this fair-skinned redhead, and I still find myself thinking, well, I'm not going to be out in the sun that long. I'll be okay. Is that a problem?
Well, you know, to get enough vitamin D, the studies show that you probably need about 15 minutes of unprotected UV exposure, but you can get 15 minutes of exposure just kind of walking around or running errands. You're going to get some of it even through your car window. So really the best thing to do is every morning, if you know you're going to be out, you're putting sunscreen on anything that's exposed. So especially your face, your neck, and the backs of your hands.
Are there some misconceptions people have where they think, well, I tan easily, so I don't have to worry?
Right. So I hear that one a whole lot, that, oh, you know, I don't really get sunburns, or, you know, I have Native American ancestry or something like that. And the truth is that people of any skin type can get skin cancer. Even African American patients of mine, even Hispanic people who have more pigment in their skin they still have that possibility of getting skin cancer. And I can't tell you how many skin cancers I've cut off people who said they tan and they don't burn.
So does a melanoma begin by looking like a mole?
Usually it does. I believe that the statistic most recently that's been looked at is about 20 to 30% of melanomas start off as a mole, as a benign, harmless mole, but about 70% or so actually come up new as a new spot that appears. For sure, the most common way that melanomas look is it's a dark spot on your skin, but there are some melanomas that are a little bit trickier, and they can even look like a pink area or like a nodule, almost like a bug bite that's not going away.
Do they all grow rapidly, though? Is that a common trait?
That is a common thing. Thankfully, there are some that tend to grow a little bit slower, but it's really hard to tell, you know, when something first pops up, if it's one of the ones that's going to grow a little slower, or if it's one of the ones that's going to grow faster. So we're always going to treat it as if it's something that's growing quickly and has the potential to spread to other parts of the body quickly.
I guess that for those of us who will wear sunscreen, and hopefully we all will, you tend to apply it physically on your skin, but is your scalp a risky spot?
Yes, absolutely. And especially, again, like you said, people who are fair skinned, who have lighter colored hair, a lot of times they don't have as much hair on their scalp too. And so there's a lot of area there where the sun gets in, and it does cause the damage that leads to melanoma and other skin cancers. So wearing the sunscreen is helpful, but really wearing a hat is even better. And
is vanity what often gets people in the end, Dr. Brown, when you say, especially to women, but men too, you know, if you'll put that on, you won't age so quickly?
It does tend to be the turning factor a lot of times, especially for women. You know, number one, because we know that sun exposure and overexposure causes those brown spots. It causes wrinkling to happen faster. It causes thinning of the skin also, which can give you bruise-looking lesions that come up faster and easier. So that part of it, but then also once patients have had a skin cancer or a pre-cancer and then have a scar left over from that, often that's also one thing that will drive them to actually be more vigilant about doing their sun protection.
We have a little less than 2 minutes left. I will let you talk about what the proceeds from the race are going to achieve. I know you mentioned the program that bears Elizabeth Smith's name at Memorial. Are those funds used to help other families as they battle the disease?
Yes, exactly. So it connects patients with social support that they might need. It connects patients with the doctors and the nurses that they need, and the information that they need to go through their treatment course as effectively, and just where they feel like they're getting the attention that they need, and have all of their questions answered.
And when someone's calling your office to make an appointment, if they need to just have a general body scan and that type of thing, if they suspect a problematic place, can they ever text you a picture, and then that can help your staff know how to get them in?
That does help. I think that works better if it's already somebody who's a patient of ours. Absolutely, if you have a spot that you're concerned about, you should mention that when you're calling to schedule an appointment. And a lot of times we can get you in faster, even if it's just to check on one spot, whether you're a new patient or established. And then we have ways now, we have to be really careful about privacy concerns and security with things like email, but we do have ways to communicate on text message and on email for patients that are able to do that.
Well, you have a full week to get out there and run the race. Again, it's happening virtually, so just lather up on that sunscreen before you head out to put in your time. Dr. Brown, so good to see you this morning.
Good to see you too. Thank you.
You're very welcome. Again, it is the Elizabeth's Outrun Melanoma. You have a full week to get your run in, April 17th to the 24th. You can register by going to memorial.org/race, or also call 495-4438. We're back after this.
I always thought it was my fault that